This was supposed to be last week. It was supposed to be, what, 2 days before Valentine's Day? Okay, and worked out very nicely that way. So now it is the week following the release of 50 Shades of Grey. So I found that very amusing. Has anybody seen 50 Shades of Grey? Okay, okay. I saw it on Friday night. And I saw it, I decided to go to it because it was about sex, and I knew it was also about domination and submission. But it's kind of a phenomenon. And I did not read the books because I lived the books in a previous relationship. So I really didn't want to kind of grind through that, pun intended. But I thought, okay, I'll go and watch the movie. And any person that you know who has lived in an abusive relationship, discourage them from going. It's really, really hard if you've been in a relationship when someone is emotionally, physically, sexually abusive. It stirred up a lot of stuff for me. The things that were interesting in the movie, though, was that this woman had enough self-esteem, enough self-worth, enough savvy to recognize that she did not want to be in an abusive relationship, which is really critically important, and she got out. The other thing that was very interesting was the man who was in it. He did a very good job of portraying someone who was abusive and who clearly had major psychological issues. And I'll stick with this for just a minute, and then we can go on from problems with sexual abuse. But when we finished up, I went out with a friend of mine. We both needed a drink. It was kind of like, whoa, because she had some issues, I had some issues. And so we went out and we had a drink at a bar and talked. And she does neurofeedback. Her name is Dr. Gail Durgan. So she treats people who have his disorder. What he had, and she was able to describe him completely, he had reactive attachment disorder, which many, many children have. And in the movie, he does not want her to touch him. The only way he wants to relate to her is his dominating her sexually. He does not want to make love, for example. Okay? He wants to dominate her. He doesn't want to be touched. He is not a warm and fuzzy guy. And that's the way these children are who have reactive attachment disorder, or RAD. They push their parents away. Frequently they are adopted. Frequently they are born to moms that have drug issues, and there's a history of the child being abused. Usually it's before by the time they're 4 years old, the damage has already been done. The man in the movie talks about, and you can see burns on his chest, which is very typical of these children. They're horribly abused. And as opposed to becoming someone with a multiple personality disorder, they block out the world and can have no emotional attachment with the world. They don't look directly at you. You know, they're talking to you like this. And we have, there's several treatments for it. One is the neurofeedback that my friend does. And she basically can rewire children's or even young adults' brains. And they can live normally. They can start interacting with people. The other thing that we have done in my office is every single one of them is low on oxytocin. All of these kids. And he was a perfect example of someone who was low on oxytocin. And some people just don't make oxytocin, and they're born that way. So there's several ways to get to being someone who does not like being touched, who has very difficult times interacting with people. And he just portrayed that very well. I'm not encouraging you to watch the movie for that reason, okay? But if you do, all of a sudden it kind of puts things in perspective, and you can have a little bit of empathy for this man who was so profoundly abused as a child. And maybe he came into this world and didn't have enough oxytocin. What's the other population of patients that don't have enough oxytocin? Kids with autism. They don't look at you, they don't like being touched, they're kind of fussy, they're into their own world. And if you give those kids oxytocin, they get warm and fuzzy and crawl up in your lap. And it changes just like that. Doesn't happen with all autistic children. But it's just, so it was fascinating to watch this guy and then be able to realize, oh, I know what he's got and I know what would help him out. Now, I don't think they're going to do a new movie with him getting fixed. But it was very, very interesting. But anybody who's been in an abusive relationship, I simply just would not go. I just wouldn't go. It took me, I watched it 8 o'clock, 8 or 9, no, 8:15. And it was done by, we were done by 10:45, and it took me to 3:30 the next day to kind of work through it and sleep and meditate and journal and call a girlfriend and stuff like that. So it was a very interesting process. And then I was okay with it. The thing that Gail commented on was that clearly she had a very positive effect on him because he had his picture taken, he introduced her to his mother. Clearly, on some level, he really cared for this woman, but he could not express it.
He fell in love with her, and he became a very warm, fuzzy person. They ended up sleeping in the bed together.
Cool.
It was, yeah.
Cool. All right. So that's my I know you didn't expect to hear that. Those kinds of people are incredibly good at what they do. They're very, very seductive. They're very, very manipulative. And you know, and I'm glad that her love for him motivated him to not become an abuser, because that's
he fell in love with her.
yeah.
So,
but that's what you're talking about. That was his motivation for changing, because he'd been with 15 other women or something like that, and nothing had changed him.
She met Mrs. Robinson a little bit.
Okay. But the point is that you don't have to have RAD, reactive attachment disorder. You can just be a narcissist. You know, you can just be a sociopath. So there are lots of ways to get into being an abuser. And so if you're in that kind of relationship, you get out. You get out. And it's hard to get out. I was in it for way too long, but you get out. Okay. So I understand you didn't want to fill out the cards. You want to just go ahead and ask your questions. Did anybody fill out a card with a question and turn it in someplace? No? No, did you know that you could fill out a card and ask a question? Okay, I remain anonymous. What kind of questions? I mean, I can talk about this subject from all different perspectives, okay? What are y'all interested in knowing? Why'd you come out tonight?
Hear what you have to say.
Okay. Is there a particular aspect about sex or sexual relationships or problems with medication or what happens to us as we get older? How does sex change then? Yeah, she's nodding yes. She's nodding yes. Yes. How about anybody else?
Same question.
Same question. Okay. All right. Other concerns? Because I want to make certain that I do answer your questions.
I would say I had a hysterectomy, and I've kind of weaned myself off the estrogen patch.
And you're how old?
I'm 48, and you know, I can take it or leave it at this point. And ironically, my husband, the same age, is kind of at that same point in his life. So I guess he's going through menopause, if you will. And you know, I mean, we're fine, and it's not really an issue in the relationship, but we're both kind of like, well, what's going on? So yeah.
Let's start with you because you're younger, and then we'll kind of go over the ages, I'm thinking.
Okay.
So you had hysterectomy.
Yes.
So I'm not going to ask you questions, I'm just going to comment on that. And you had your ovaries taken out because they put you on the patch?
Everything.
Okay. All right. So some women will complain when they have hysterectomy that their orgasms are different. Okay? And other women, doesn't seem to faze them at all. And it really doesn't have to do with, is it a clitoral or a vaginal orgasm? There's some women that somehow just the way that their nerves are hooked up, their orgasms are just not as intense after having a hysterectomy. And I don't know any way of fixing that, okay? Most clitoral orgasms are going to be basically focused in the clitoris, okay? Vaginal orgasms primarily are at the entrance to the vagina. And so things that can enhance your sexual responsiveness are using some localized testosterone. Now, testosterone works its best when you also have some estrogen and you also have some progesterone. But many women can get satisfactory results using a little bit of testosterone, and depending upon how often you want to have sex, and I'll come back to that in a minute. I mean, there's some couples, Friday, Saturday night, Sunday morning, that's it. That's all they have time for, okay? And so I'll have those people, I'll have those women sometimes put a little bit of testosterone on each day, just a little bit, to kind of keep the area primed, so to speak. And when I say put it on, I'm going to be very direct, I'm going to be very blunt, okay? Because if I couldn't put all this in the article, okay? But if a woman is applying testosterone to her genitalia, kind of rub the area, okay? Increase the blood flow to the area before you even put the testosterone on. And then the testosterone also will enhance blood flow to the area and basically turn the nerves on. You can either use a little bit each day and then maybe put some more on, say about 30 minutes before you want to have sex, on the clitoris and right around the entrance to the vagina, because that's where the nerves are. You don't have to stick it up inside. And that will work very well. There's some women that find, I don't need it earlier in the week. It's a little bit messy, Maybe I'm wasting it on my underwear or something like that. And I'll say, use it twice a day, Thursday, Friday, Saturday. Use the whole week's worth of testosterone. Just load your system with it. And some women will find that works very well, okay? Now, as you get older, whether it is because, you went through a surgical menopause, you don't have any estrogen left. You probably have some because you've got some fat, and your adrenal glands kick in as you progress through menopause and produce some extra steroids that go out into your fat and get converted into some estrogens. But those estrogens are not as strong as the estrogens you used to have. But you may have a little bit of estrogen left over. But if you have vaginal dryness, you have to take an estrogen with the testosterone. And what I use is estriol. So say if a woman has had breast cancer, okay, and I've gotten clearance from her oncologist that she can use testosterone, but they don't want her on estrogen. I'll use estriol, which is a very, very weak estrogen. It's about as strong as flax seeds. So flax seeds are anti-cancer. The estrogens in flax seeds are anti-cancer. The estriol is also an anti-cancer estrogen. It basically blocks the estrogen sites in the tissues that are sensitive to estrogen and keeps environmental estrogens or stronger estrogens that you're still making from stimulating the cells. All right? But your vagina is exquisitely sensitive to estriol. So if you want a younger, healthier vagina, which will help keep you from getting urinary incontinence, will help keep you from getting low-grade infections down there, which will allow you to have a moist vagina and allow you to be able to enjoy sex. I'm not saying that you'll never need to use a lubricant. You may still need to do that occasionally, but you won't be relying on it, and your vaginal tissues will be stronger. And a little bit of testosterone down there makes your vaginal tissues stronger, so you don't tear, so that you don't get irritated when you have sex. So a combination of estriol and testosterone in a cream works very, very nicely to enhance sex, and also it'll increase your libido.
Can they also include a little progesterone?
Yes, they can.
Okay.
Yeah, they can. And men's testosterone and men's sperm counts have been going down. I mean, I started hearing about sperm counts going down and testosterone going down in the late 1990s, as we were beginning to realize that there were so many different toxins in the world, and they were affecting us. So that's a very real issue. I mean, they were forecasting that if men's sperm count continued to drop as quickly as it was over some period of time in the 20th century, last century, that basically men would be sterile within 75 years. So I'm seeing lots of younger men with low testosterone. I'm seeing not a lot of younger men with azoospermia, no sperm. But I'm seeing guys with lower sperm counts also. So it's very real, and it is impacting those organs. Of course, and I talked in the article about, this is your biggest sex organ. And if you live a typical American life, where you are constantly multitasking, you're constantly worrying about finances, you're constantly taking care of kids, and you're taking care of your parents, and you don't have any downtime, and you are surrounded by electrical equipment and cell phones and iPads and all of this stuff, all of that exhausts our adrenal glands and exhausts our bodies. So if you can get away and go to the beach, if you can get away and go to the mountains and leave all that electronic equipment behind, go someplace that does not have Wi-Fi, all right? Just check out for a while. Your body will relax and you can better relate to each other again. I mean, if you used to enjoy sex, okay, I would encourage you to continue enjoying sex, because this is in terms of our energy levels, okay, couples that have sex throughout their entire life do much better together. And in terms of our energy levels, this is our second chakra. I mean, this is our creative chakra, creating children with sperm and eggs, but it's also a source of creativity for us, and it's reflected upstream in the higher chakras. I think you tend to be more vital if that is still a component to your relationship, okay? And he needs to get checked out too. So don't settle for less. Now, there's some people that came into this world and they've never had a big appetite for sex, okay? Giving that person testosterone usually does not work. Might work in a guy, it might work in a guy. Generally does not work in women, because we are just more complicated. A lot of times when I'm working with women like that who want to have a greater interest in sex, I will also have to give them, in addition to testosterone, I'll have to give them something that raises their dopamine. Because dopamine is what is the neurotransmitter that, I mean, it helps with, it's critical for erections and orgasms and things like that. And it also is critical to be able to have focus on your partner and have passion for what you're doing. If you can't get into it with sex, it's not going to be much fun. If you were thinking about this laundry list of things that you have to do over here, sex is just going to get in the way of you getting whatever task done. But you won't be able to enjoy your partner or gift to your partner you, the most intimate part of you that you can share with anybody. And I honestly think that sex feels good because this is one of those intimate ways that grown-ups can play with each other. And it allows us, in a sense, to play, to have time off, to be able to, you know, to bear our souls in addition to our bodies, and be able to enjoy somebody. So I think that you know, if you enjoy sex, I encourage people to find the right person to have it with, and be able to enjoy that person.